Hello, welcome to adaptnclex. When it comes to the NCLEX, you have to go in with some strategies. Strategies like weapons in your hands that when you see any question, you know what to do with it. You cannot walk into the room that you have no clue how you're going to answer a prioritization question or how you're going to answer a select or that apply question or how you're going to answer a pharmacology question. If you need that answers, well, just check my channel. I have great videos for you. But when it comes to prioritization, I want to provide you with the best weapons that you have. A versatile tool that can handle any prioritization question. Your all the most of the portion of your test is all about prioritization. That is modified into select or that apply sometimes content. So both prioritization and sata questions are almost the same because it's coming from the content. It's the content that is giving you most of your risk factors, then signs and symptoms. And so when you know the signs and symptoms, which of the signs and symptoms you should prioritize. And that is what it's all about. If patient is having this problem, which of these signs and symptoms you have to worry about. And that is all. That is what the exams is about. If they don't ask you that, they asking you to list all the signs and symptoms. Or if you know the signs and symptoms, how do you teach the patient to take care of it? Or how to prevent it from happening? So I offer you be sharp. Try it and see. You will never go back. This is the key for prioritization. And this is a versatile tool. As you can list, I have a couple of information on it. We have 1, 2, 3, 4, 5, 6, 7, 7 things that you should pay attention to when you're answering a prioritization question. And I will demonstrate how it functions. And as you can see, at each segment, each pathology, there's specific things listed. Those are the things to keep you focused when you see a prioritization question. So that's a box made up of tools there to help you fix any prioritization problem. You are not taking a test to make you an expert. We're trying to move you to another stage of your learning process. So they don't expect you to be an expert. They want you to have some critical thinking, a little bit of thinking that you'll be able to realize that, oh, this problem is a priority that I will not cause a problem. And when you get to the floor, you matured and you become an expert. And so you need to achieve the entry level kind of thinking. And as you achieve that through your content. And as you have achieved that, you move on to the next step. And that is all what the exams is about. So I'm going to demonstrate it with breaking down what the B sharp is about and each component and what it means. Then we try with the question, specific question, how you can demonstrate it. Being sharp, it means you have achieved an entry level content, not an expert, just an entry level content so that you can answer the question appropriately if they offer to you and you see something that is abnormal. So an entry level content based on the pathophysiology will give you the idea to be sharp. And that is my method of prioritization, how you approach prioritization question. Is B sharp. The B is a breathing problem. These are the things that always cause patient morbidity. There's so many things that cause them, but these are the ones if you don't do anything, they're going to have problems. So I put them together in the form that you say these are the conditions that I need to worry about. Look at them the second time. So breathing, so this is breathing. That's the breathing. So there's certain things that cause breathing. So anything that affects the lung itself. And as you can see, I draw it like that. Lung, like if you have pulmonary embolism or if you have pulmonary edema, all this thing can cause problem. Okay, if you have a pneumothorax, it can cause the lung not to breathe well. And that is something that you have to worry about. Even if you have a DVT, DVT turns into PE, and then that also causes a breathing problem. So there's few things that are over there that you should be worrying about. Then the E is the electrolyte. So few electrolytes that you control your body homeostasis. So your calcium, your magnesium, potassium, and sodium. When these levels are low and high, you should be very careful that they're going to cause a problem. And so when you see those answer choice, look at it twice. I give you a calcium of 17. That's really, really high. Calcium of 6. That's really, really low. And the patient will tell you, I'm not feeling well through their physical exams. That's all what this is being sharp is about. And the S is sepsis, okay? Sepsis and shock. They look alike. Basically, sepsis is infection, but it's a severe form infection. Patient temperature can be low or high. And then they may have blood pressure will be down. So hypotensive and tachycardia. Those are the key words you're looking for. They give you a temperature, they give you blood pressure low, or and then heart rate high. You should be thinking about sepsis. Or somebody just had surgery and the wound doesn't look fine. That is sepsis. You got to intervene. And then the S, which is the shock. Shock is the same thing. Um, they have blood pressure problem, very low, heart rate high, and their mental status will change because it's hypoperfusion problem. They are not getting blood into their brain. So, and the thinking is affected. The whole body system is affected. So it's a bleeding problem. They're bleeding, which is shock. Any person that they give you a question that is bleeding, you should be worrying about. Then this one is hypothermia. That's the H. Okay. So we're talking about temperature that is low, like 97, 96, 96, okay, Fahrenheit. That one is not good because hypothermia is usually, I consider that as a cardiac problem. So 96, you get cardiac arrhythmia. Okay, so those things are not normal. Okay, that those things are not normal. So you should be thinking about it. And hypoglycemia, they like tricking you with this. They will give you a sugar of 500. Don't worry about it. Sugar 300. I'm not worrying about it. Unless your sugar is less than 70, I'm not I'm not worrying about you because when your sugar is low in the 60s, your brain function cannot work. The whole body system is affected. You become lethargic, you become confused, and your whole body basically in a hyperdynamic state in order to get all the energy that they need. So that's what you're looking. You're just being sharp as an entry level nurse. And then this, you see, it doesn't have the lung there. This is your number one, and that is the airway. Anything that is affecting this pipe, you have to be sharp about it. So if the patient has a stridor, yes. If they're drooling, yes. You see, if there's like tracheal deviation, anything they give you, there's a bronchial something, they mention bronchioles, they mention trachea, they mention larynx. I mean, you just basically trying to be supraglottic, something, whatever they say that is associated with this tube, I have to pick it as my number one, no matter what, because it's the tube that is bringing oxygen into the lung. So you have to pay attention, and that is number one. And of course, the R is lethargy. That's a neurological problem. So when you're lethargic, your brain doesn't function well. And when your brain doesn't function well, it affects your breathing system because that's where your breathing is located. It can also affect your circulatory system. So this is why a neurologic problem is very important. So they become lethargic. They will have acute mental state change. So anybody in your test that they give you and is confused, you have to worry about it. Confusion is always a problem. You got to figure out why they're confusing. Is it because they have electrolyte problem or they have neurological problem? So you got to figure out. Any patient who had a seizure, yes, is a problem that I should worry about because of the airway issue. And even they can give you restlessness in over here in airway. I forget about it. Restless. You cannot take this as anxiety. They give you restless. It's either they have an airway issue or some form of breathing issue, but mostly airway. And you should consider it as very, very serious problem. Okay. So that's all the information you need to know about being lethargic. When they give you a patient who's lethargic, he just have acute mental status change, just had a seizure. Look at him twice. And my favorite is pain. Okay, we all have pain, and pain is always a trick thing they give you in in your exams. Every patient that come in may have a sort of pain, but you have to figure out which pain you have to be sharp about. Which pain, as an entry level nurse, can you weed out? And you said, no, this is the one I need to be sharp, extra careful. And the way to know about it is the pain that is going to affect the individual life, their lung, and their eyesight. So if you have a pain in your eyes, and I know this kind of pain can make you lose your eyes, I'm choosing you as a priority action. If you have a pain in your leg, and I know you can lose your leg, I'm choosing you. If you have a pain that I know if I don't do anything about it, you're going to die or you're going to lose an organ, I'm choosing you. And that is the pain for that will cause you to lose your limb, life, and the eyesight. And that is the key. That means you're critically thinking, you're using yourself as an entry level nurse, and you are being sharp. You see how it's connected? This is the critical thinking right here. That I'm being sharp, I'm critically thinking, and as an entry level nurse, I'm prioritizing adequately using this technique. And as you can see, these are a bunch of words put together with disease process that is very common. It has very high morbidity, high mortality, and I have to be extra careful. It's a toolbox, basically, that you carry with you, like your Bible, and you take it with you and say, this verse, I've seen it before. I've seen DVT is a breathing problem, and I need to apply it to be able to take care of my patient. You are just being extra careful. You are just being focused. Remember, every patient is a priority. If they give you 4 patients, all of them is a priority. That is why they came to the emergency room. They came there because they have a problem. To them, they have a priority problem. But you, as an entry level nurse, is to be sharp and see which one I need to take care of first. All they asking you, take care of 1 patient at a time. But who do you want to choose? 4 patients, who do you think deserve the first position? How do you do that as an entry level nurse? Is to be sharp. And being sharp is take care of the breathing issue, take care of electrolyte issue, take care of sepsis and shock, take care of hypothermia, hypoglycemia, take care of the airway, take care of a neurological problem, and take care of pain. But how do you do that? Classify them here. You may get airway, lethargy, pain, and sepsis patient. But then you got to go to the second level of thinking. That is where the advanced level come in. But as you know, based on the disease process, you know which one can kill the patient first. If I have an airway issue, neurological issue, and a pain issue and a shock, I'm choosing an airway. If there's no oxygen coming in, you're dead. I can give somebody blood to help with the shock or sepsis, give them antibiotic, pain, take care of the pain. But this one, I don't have time, minimum time. Do you have time to do something else? Yes. And therefore, that's why I would choose this. If I have a breathing issue and a circulatory and a shock, I'm choosing a breathing issue because it's still the lung. I know we always say ABC, I hate ABCD, whatever it is, because it does not let you be sharp. It doesn't let you think. We want you to think as an entry level nurse so that you can prioritize. So this is the key for um, entry level nurse who is trying to take your NCLEX. Which of the following patient required a priority action? A client 48 hours after surgery and blood thing stain on the dressing. Well, he just had surgery. This is incision and a stain in the dressing. That's serosanguinous drainage. That's a suspected finding. There's nothing, no signs of erythema, no drainage, no, and nothing they've told me. Okay. A client with peripheral vascular disease with dry black gray toe. Okay, it's dangerous. You say, oh, dry, black, gray toe. Well, a patient with peripheral vascular disease, that's the peripheral artery disease, that's what I mean. There's decreased blood flow to the leg. You expect them to have gangrene in their gray toe. But look at it, this is black and dry. That is dry gangrene. That is not sepsis. Don't get distracted by this. I just put it this there. This is non, it's suspected. It's supposed to be gangrene. It's dry, and so we don't see him. A client 24 hours after gastric bypass with what? Board-like abdomen and a heart rate of 95. Even though this is low grade tachycardia, this is bad. Whenever they give you a gastric bypass patient, look for fever and shortness of breath. These two indicate a leak. That means they are connection is leaking stool, or they have PE. Those are the two symptoms: PE, pulmonary embolism, or sepsis. If they have any little fever, even 101 or 99.5, close to 100, you have to worry about them. They have pulmonary embolism early after surgery, and they can have sepsis. So this patient has the key buzzword: board-like abdomen and heart rate of 95. I'm seeing you. This patient is doing what we call leaking. It's leaking stool into the belly. You have to see them. A client with suprapubic tenderness, fever, and burning or urination. Okay, you have fever, you have suprapubic tenderness and burning. What do you think? This is also infection, right? Yes, to UTI. Who is more dangerous than? Who do you think is more sick? Yes, somebody who's leaking stool into their belly is more important than somebody who has a UTI. Sometimes you have to apply your knowledge and content. The B-sharp will help you focus and make a diagnosis. This is a sepsis. This is a sepsis. Who is more septic? This one, number 3. This guy, I'm not seeing him. We'll take care of you later, but this patient is leaking.